Thumbcoast TV and WGRT bring you St. Clair County at the Mackinac Policy Conference. Sponsored by the Community Foundation of St. Clair County, Michigan Mutual, and Eastern Michigan Bank.
Josh Chapman here again, joining you from the Mackinac Policy Conference, and I'm with Brian Peters. Brian, how are you, sir?
Doing very well. It's a beautiful day on the island.
It is. You know, I've worked in several worse places in 65 sunshine on the porch. So I appreciate you joining us here with the Michigan Health and Hospitals Association, correct?
Right.
And what a time to be alive in the healthcare field. You know, what are some of the challenges that we're seeing? Obviously, we're hearing a lot of the rhetoric or the information coming out of D.C. in terms of impacts to the healthcare field. What are you seeing or concerned about coming out of that piece of legislation?
Well, as you said, healthcare truly is in the spotlight right now because when the United States House just last week passed the One Big Beautiful Act, Medicaid is a very critical component of that budget bill. In fact, we are very concerned that if the House version of that legislation survives the Senate discussions that will take place over the course of the next few weeks, we're going to see real access challenges right here in the state of Michigan. I say that because not only would Medicaid reductions affect Medicaid recipients, which is obvious, but when a hospital has to curtail services, when we have to lay off staff, and we have to eliminate an entire service line because of Medicaid underfunding, that lack of access now affects everyone in the community regardless of what sort of insurance coverage you may have. And so we're really sounding the alarm bell. We're talking with our United States senators now as this debate shifts to the Senate to really indicate how this would play out here in the state of Michigan. We want to make our voices heard, and that's really part of what we're doing here on Mackinac Island this week at the policy conference.
And it even extends past just hospitals too. You know, one of the things that I've seen that I'm mildly interested in is talk to me about rural hospitals, the impact that this would have on rural hospitals. So not your mega centers, but where most
Right.
Michiganders get their health care, and then potentially other ancillary services, facilities for seniors or different things like that.
Absolutely.
Do any of those spaces are they negatively impacted, or should folks be concerned?
Absolutely. In fact, starting with your excellent point about rural hospitals, we know that people who live in rural Michigan tend to be older, sicker, and poorer. And because that is the reality, and because many of the hospitals in rural Michigan are truly freestanding independent facilities, even though that's changed over time to some degree, they have less margin for error, so to speak. They, during the COVID-19 pandemic, for example, had very little days cash on hand, for example, to the point where they were concerned about their ability to make payroll, if not for the fact that we had emergency funding that came into play to help keep the doors open. So we learned our lesson, and we know that if these Medicaid cuts come through to the finish line, many of those rural hospitals are going to be right back in that same boat. So your point is spot on. And then when you think about the other components of the healthcare ecosystem, whether that's rural health clinics, whether that's federally qualified health centers, skilled nursing facilities, and certainly physician offices as well, to the extent that those physicians see Medicaid patients, and most do, they're absolutely going to be in a very difficult spot as well. So for a lot of reasons, we're concerned about what the U.S. House just passed.
Essentially, revenue will drop, and expenditures, as we know over the last couple of years, will continue to rise, and it'll definitely be a challenge. You know, Brendan, what other trends are you seeing out there that again, the healthcare space after 2020 has rapidly changed. What other trends are you seeing?
We're seeing the implementation of new technologies, certainly, and that includes AI. AI is a hot button issue in multiple sectors, but I really believe healthcare could be the one sector of our economy that has the most to gain from the implementation of AI, if it's done properly. And then the other that I touched on a moment ago is this trend towards integration and consolidation. We're certainly seeing that with the advent of mergers here in Michigan between multi-hospital systems. That's not unique to our state, by the way, when we look across the country. We're seeing physicians who maybe 30 years ago were in small group practice or solo practice and just had hospital admitting privileges, Now, for the most part, they are full-time employees of our hospitals and health systems. And there's a host of reasons why that's been the case, but we continue to see that trend play out in Michigan. At the end of the day, we think it's a good thing in terms of economies of scale and leveraging the ability to follow patients through their care experience throughout the care continuum. So again, these are trends that we're following and we're helping to accelerate.
Well, Brian, I appreciate you sharing with us today. I think it's very important to get this message out here. It's not picking a side, but it is important for folks to know, what potential impacts, on their health care could come from, some of the pieces that are talking about in case they want to, write their legislator or whatever the case may be. So keep up the good work. It's not easy, but we appreciate the work that you're doing.
Thank you so much. Appreciate you having me today.
And thank you for joining us from the Mackinac Policy Conference.
To hear more from this conversation, visit thumbcoast.tv.